This module on the use of the MATRIX Gait Trainer is specific to Parkinson's. Now, we know with Parkinson's disease, we have a lot of different presentations that we are working with. One is obviously the balance issues due to either some sort of festinating gait, shuffling pattern, and even the freezing. So what we're going to do is show you ways to break up these patterns to really maximize the times that you're doing gait training with individuals with Parkinson's disease. First, we're going to start off with just the overall presentation of the MATRIX Gait Trainer. We know we have the adjustable armrest, so do fit it to their size. Remember, about elbow, give or take 30 degrees. And when we're using it, although they may have a weak side, we're going to want to use both foot straps in order to provide more of a reciprocating motion with the feet. So go ahead and start sitting down. And so I'll go ahead and pull this box up. And once I'm here, we'll go ahead and put these on the patient's feet. Make sure it's nice and snug. And having worked with a lot of Parkinson's patients, we know that there's a lot of tremors that could be going on, a little bit more rigidity. So this will be specific to each person based on the tension that you put on the bungees on the gait trainer. So what I'm going to do is make sure that these are about hip width apart, a good stance. I'm going to apply a little bit of tension. Let's just assume that this first demo is someone who has more of the freezing moments. Now the freezing moments, you'll find that sometimes the bungees may cause a little bit more tremors, but there's a way to break that as a way to go through with the motion. So assuming that I'm standing up, obviously someone there is guarding. This will only require one practitioner to help support and move the gait trainer. Now, if you see a lot of this, help normalize it. The more they put weight through their feet, the better, right? So once they're nice and stable, what we're going to do is I'm going to start with a little bit more increased tension than what I would normally put for someone with more of a shuffling pattern, just to help break that freezing moment. And what we want to do is when we're walking, we're going to keep the walker maybe about 2 to 3 inches away from the hip. Not so much that they're tucked in, because it's not going to be much tension, and then they're going to want to move backwards. So I'm going to have them slightly lean forward, hands in a proper position, and as they unweight, now this is the biggest thing. With freezing, we just want to unweight them, not so much force the movement. So if the tension is tight enough on the bungee, if I were just to unweight, it's going to passively move my foot forward. Therefore, they're not having to resist it. All they're doing is moving the weight. And so each time that they do that, if they're shifting weight onto the other one, it's going to give them that assistance. Now, right now, this bungee is about 50% assistance, okay? But as they start to weight shift, you'll notice that they'll get more relaxed and more relaxed, allowing more fluid gait patterns. So what you'll find, initially, a little bit of stiffness. You shift, bringing it a little bit more in front of you than what you would like. All you need is that first foot to go through, and then whether you're guarding at the hip, the trunk, whatever your facilitation methods are, then you'll find that the legs will start to move through a little bit more fluid as the person goes through. Now, when we're talking about how many trials does it take to see bigger results, I use it 5 sessions, so 5 trials in 1 session 5 times. And typically what you'll find is a lot more fluid gait pattern, especially when they transition onto their regular walker, whether it's a rollator, standard walker, or anything else they might use, maybe even forearm walker. So now what we're going to do is we're going to talk about the more fascinating shuffling gait patterns. What we did on the bottom here, we're still having making sure it's about the stance, and we put the tension a little bit more just to make sure that we're going all the way into a step through pattern, okay? We don't want them falling short, because then it kind of defeats the purpose of the use of this device. So start off with more tension. As the person improves, then you can put less and less tension until they are performing the reciprocating gait pattern on their own without use of the bungee. So again, we would start off in sitting, make sure once they stand up, you're guarding on either side. And now what I'm going to do is, you'll find initially they may want to resist that motion. So because that tension feels much different, they're going to try to pull back. that part won't last as long. At some point, they're going to get tired of doing that, and they're going to allow their feet to move forward. So it's a good way to also help fatigue more of the posterior chain in order to get the front chain moving. So as I'm going here, if they try to resist, you might find more of this pattern, which is going to be normal, okay? As they go through, it's going to bring their leg all the way forward. So when you think about shuffling, they're still activating at least 50% of it to get half of their foot forward. So if we have the bungee tight enough, and I'm actually going to go a little bit tighter on this one here, to really make sure that I'm stepping through, it's almost going to feel like their foot is flinging. Don't worry about that, because what it's going to do is after a few trials, then you go back to that original tension that you had before, and you're going to find that their feet are going to be moving much more smooth as they move forward. So again, I'm keep making sure that this device is maybe about 3 to 4 inches in front of me forward. As you're guarding, you can either guard them or you can even guard the device to make sure that that device stays forward so they don't fall backwards. So as I unweight, even when I try to resist, it's a little bit harder for me to do that, and it allows me to take more of a step through pattern as I walk forward. And again, one more try. And this is going to vary depending on the person's height and weight. So if you feel like they're a lot stronger and they may be resisting more, you may have to crank up the bungees a lot more or a lot tighter than you would for someone who's maybe, you know, about 100 pounds. So keep in mind, both booties would be on. Adjust the tension. For me, it takes usually about 2 to 3 times to really get the right fit of the tension, and then you'll do your 5 trials until you do the next one. So this is a way to really break up and improve fascinating and shuffling gait patterns. That way they're able to transition onto their walker, either this device or another device with a lot safer movement patterns and a more fluid gait. The purpose of this device when it comes to both the freezing and fascinating shuffling gait patterns is to reduce the amount of energy that a patient is exerting while they're trying to walk. Whether if they're freezing, they're trying too hard to try to move, it's going to exhaust them. If they're going with partial step through patterns, it's also going to exhaust them. So not only are we trying to fix biomechanics and safety, allowing them to walk more fluidly in their home or out in the community, we're trying to reduce the amount of energy that it takes to do so. So you may also find that patients can walk a lot longer because they're not having to fight against that resistance of what, you know, their standard walker would cause without the appropriate gait training.